Good morning. My name is Jenny Manivannan, and today I'll be focusing on the impact climate change has on clean drinking water in South Africa. To begin, it is important to look at the geographical location that I will be focusing on. In this case, South Africa. South Africa is located in the southern part of Africa, having warm temperatures from 0 degrees Celsius to 35 degrees Celsius and very low rainfall. South Africa is also known to be highly dependent on sectors such as agriculture and forestry, which depend on climate change and rainfall. As a result of climate change, there's an increased number of droughts and reduced water resources. In a study done in 2009, it was shown that poor quality of water was one of the most significant factors of death in developing countries. South Africa, communities lack treated water from wells, rivers, and other surface waters of drinking or any other purpose. In addition, the fluctuation of temperature and rainfall patterns within South Africa create a significant prevalence of diseases. To expand on this point, it is important to look at the connection between water and health. As previously stated, climate change and contaminated water are factors in the prevalence and transmission of diseases. In developing countries, 15% of patients develop an infection during a hospital stay due to contaminated water. It is estimated that about 842,000 people die each year from a disease called diarrhea due to unsafe drinking water. This disease prevails in areas such as South Africa, where water is not always available. But what is diarrhea? Diarrhea is an infection in the intestinal tract due to bacteria and viral organisms. In places like South Africa, this infection spreads through drinking water. It is the frequent passing of stool that often causes death due to severe dehydration and fluid loss. Diarrhea is also known to be the second leading cause of death in children, but it's both preventable and treatable. Then why is it important? Why is this a problem? Because it hasn't been fixed. Today, there are still children and adults that do not have adequate access to clean drinking water. At this point, we all know the importance of climate change and how it works. However, for a brief explanation, climate change is an increase of greenhouse gas emissions and impacts the atmospheric concentration of CO2. This causes an increase in global temperatures, precipitation, sea level rises, and severe weather. In places such as South Africa, it increases dryness. When thinking about how this affects water access, it is important to note that the climate change changes precipitation, temperature, and water evaporation. The decrease in rainfall in South Africa also decreases the availability of waters in wells and rivers. The impact of this increased evaporation and loss of water quality creates contamination of the existing water supply. There are now large water networks and infrastructure that are allowing water to be transmitted between different regions of the country. However, they need to be adequately maintained and established for local centers and regions to benefit. The continuous investment and maintenance of these resources are essential in order to decrease the impact of contaminated water. Water resource yield model is now being developed for individual systems in South Africa to provide water supply through dams and large transfer systems. WHO and UNICEF closely work to prevent child death due to diarrhea and achieve access to drinking water and healthcare facilities at homes. However, smaller regions within South Africa are still lacking adequate access to clean drinking water. As learned in class, environmental justice refers to protection from environmental risks that can affect human health with the participation of communities and individuals. This also includes enforcing protective measures. Environmental justice also consists of the distribution and protection through laws, regulations, programs, and resources. For example, in the case of accessing clean drinking water, South Africa, all individuals must get access to clean drinking water across the country. This means that the program already mentioned also used for smaller regions within South Africa, such as Venda. Venda is a small region that is often not seen due to its poorer economical stance. That does not mean they should not get access to clean drinking water. Often, people and children from this region need to walk a distance in order to get access to clean drinking water. For individuals in South Africa to get adequate access to clean drinking water, private programs and systems need to be managed and organized through laws and regulations. In addition, having guidelines to waterways and water quality is important in preventing water contamination from waterborne diseases. These guidelines, laws, and regulations also need to be able to manage where and who is getting the adequate water supply they need. Like places in Venda, there are many regions that are often overseen due to its small population and poorer social economical stance. But this should change. Laws and regulations and guidelines should be able to manage and organize getting adequate access to clean drinking water all across South Africa. Thank you. I hope this presentation was informative. Thank you for watching.